If you're having frequent problems with burning in the chest, burning feeling in the abdomen, taking antacid syrups, acid suppressant medicines and think that acidity is normal, you might be just treating symptoms. Many people in our country are treating their acidity problem wrong. In this video, I will explain what they are doing wrong without knowing the actual real reasons and what they should be doing instead. Firstly, what is acidity really? Let's correct the biggest misunderstanding. Acidity doesn't mean that you have excess of gastric acid in the stomach. Our stomach produces hydrochloric acid, gastric acid, which is essential to break down the protein, kill the harmful bacteria, keep the absorption of certain nutrients like iron, B12. Problem starts when the gastric acid that should be in the stomach is moving in the wrong direction, what we call as reflux. If it becomes too frequent, then it becomes disease, gastroesophageal reflux disease. Between our food pipe, the esophagus and the stomach, we have a ring of muscles called the lower esophageal sphincter. When this weakens, gastric acid travels upwards. So the food pipe esophagus is extremely sensitive to the stomach acid, which is why you start to get that burning sensation. You do not actually have too much of acid, you just have acid in the wrong place. The number one mistake people make in our country, quick relief culture, because they just want quick relief. They don't care about understanding the problem. Many people, even if it is occurring for months on end, burning sensation, they take some Eno, some antacid syrup, get relief, repeat the same. This can go on for days, weeks, and sometimes months. Antacids neutralize the gastric acid for about half an hour or an hour, but they do not fix the ulcers you might have. They do not heal the erosions, chronic gastritis. They do not strengthen the weak valve, the lower esophageal sphincter, and they do not recognize if there is precancerous changes. So you're just treating the surface and not the actual underlying problem. If you're requiring to take antacid syrups, anti-acid medicines like PPIs, proton pump inhibitors, more than 2-3 times a week, that now becomes chronic reflux that requires evaluation. Second mistake people make is ignoring the nighttime acidity. Night reflux is actually much worse if you compare to the daytime, because when you lie flat, you lose that protective effect of that gravity, the upright position. So acid can come easily in contact with the esophagus, the food pipe, especially if your valve is weak. So the chances of injury to the mucosa, the lining of the esophagus, happens repeatedly when you're in deeper sleep. You don't always kind of feel that burning. So this starts to cause that silent damage to the esophagus, resulting in that esophagitis. In some people, we see such bad damage, almost narrowing of the esophagus because of repeated acid reflux and chronic erosion. The changes in the lining of the esophagus causes this precancerous condition called Barrett's esophagus. If you're getting up in the night with burning, repeated dry cough, irritation in the throat, or if you're experiencing liquid that comes up into the mouth when you lie down, do not ignore this, because night reflux is much more dangerous. It can affect your airways, your voice box, and even your dental enamel. Mistake number 3, thinking spicy food is the only reason for their acidity. Spicy food isn't the main issue. It's about the size of the meals. If you're eating large meals in the wrong time, especially at night, this can cause reflux. Obesity, if you're carrying more weight in the center, it increases your abdominal pressure and can weaken the valve. Many Indians eat after 9 p.m., 10, 11, because they are tired, they go to bed straight after. You had a long day, you're not eaten properly in the daytime sometimes. You try and make it up by eating more heavily at night, greasy, oily foods that are sitting in the stomach for a lot longer, increasing your chances of reflux. People consume alcohol regularly. That can also worsen the esophagitis and the reflux issue. Smoking can weaken the lower esophageal sphincter, the valve that controls the backflow of the stomach acid. Fizzy drinks, carbonated, all these colas, excess of caffeine, coffee, tea, indulgence in a lot of chocolate, all these can increase the chances of reflux and acidity. Mistake number 4 is many people I see in my practice taking these proton pump inhibitors, PPIs. They are effective, but you need to use it correctly. Many people have never even consulted a doctor and start self-medicating for months and some years. Problems arise when they're taking it for so long without a proper diagnosis. So they start to depend on it for years together, unnecessarily thinking it is acidity when their problem might actually be something else. So they then try to stop abruptly. That causes rebound acidity, so they go back on it again. So long-term acid suppression without a gastroenterologist input is a biggest mistake. It can affect nutrition absorption, including the B12, the iron, magnesium levels. It can also, unfortunately, in some people, delay the diagnosis of potentially cancer. Taking temporary medicines, it's fine, but it should not go on for months and certainly not for years. Acidity problem in young Indians, this is the rising trend. We are seeing reflux even in teenagers now. A lot of people I see in my practice in their 20s and 30s. Why? Because urban India is changing people's digestive health. Gastroesophageal reflux, of course, worldwide it's increasing, including India. Why we are seeing more young people with this? Because of one, sedentary lifestyle. Lot of time spent in front of the computers, watching mobiles, not much exercise, gaining weight, central weight. There is a lot of comfy eating, watching the screens. So indulging in more food without paying attention to how much they are eating. They are stressed. Poor sleep pattern, unrealistic targets, no proper meal timings, lot of fast food culture, weekend binge drinking of alcohol, frequent eating in the restaurant. So you end up consuming high amount of calories. What are the red flags or the alarm symptoms that people with acidity should never ignore? If you're having difficulty swallowing the food, that's not normal. If the food is getting stuck, then you have a real issue there. If you're having repeated vomiting, if you're losing weight without trying, or if you vomited blood, or if there is jet black motions, these symptoms require urgent evaluation. They're not just like a simple gas or simple acidity issue. They are warning signs that there is something serious going on beyond your day-to-day acidity. You might require endoscopy to diagnose the problem. This is not something you can rely on an ultrasound scan or on a blood test. If your symptoms go on for months, if you've been taking antacid medicines frequently, if any of these alarm symptoms, what I mentioned, are there, or if you have a family history of stomach, esophageal cancer, all these are indications that one might require endoscopy, because it allows us to directly inspect the food pipe, the stomach, check for any ulcers, check for any structural damage in the esophagus, or check the valve of the food pipe if there is a hiatus hernia. Simple procedure, extremely safe, takes 5-6 minutes. Early detection prevents complications. Reliance on medicines in the long term give you a problem. So in order to manage acidity, what I tell my patients is, firstly, getting the diagnosis right. Is this actually gastroesophageal reflux, or is it something else? Secondly, correcting the lifestyle. Eat smaller meals, finish the dinner 3 hours before sleep, try and eat early at night. Keep the head end a little bit elevated, not too much elevated, because some people have cervical spine issues if it is too elevated. Reduce the size of the abdomen, so losing inches in the waist, so reducing that central weight. Keeping alcohol intake to occasional. If you're a smoker, quit, because without quitting smoking, your reflux won't go away. Most importantly, meal timings. Avoid eating, especially after 9 p.m. And if you do end up eating late, try and eat something light. Acid reflux, acidity is easily manageable, but daily acidity, remember, it's not normal. Your body does not give you symptoms without a good reason. Especially youngsters I see in cities like Bangalore, who are kind of skipping meals or eating at odd times. That tends to create more problems. So try and maintain a meal schedule, because your system, the digestive system, requires some discipline. Thank you.